Hello guys, my name is Olayemi. You're welcome to HafrikTV. In the studio today, we have a doctor. All right, so the funny thing is that we actually haven't had any doctor or anybody in the health line before. So this is our first time. So are we going to get a hooray? Thank you, guys. All right, so we have Dr. Fortune in the studio today with us. Dr. Fortune, how are you?
I'm fine, thank you.
How do you feel being here?
I feel good. I've heard a lot about HafrikTV.
Can you hear that, guys?
Yeah, and all the wonderful works you guys have been doing. So then I'm honored to be on the show to talk about what I do. Yeah, so.
Thank you very much. First of all, you need to do something for us. Kindly move this closer to you so that your audience can hear you very well. Is that okay?
Yeah. All right.
Thank you. All right. Thanks. Thanks for the compliment, actually.
Sure.
So first of all, where are you from?
I am a Ghanaian.
A Ghanaian.
Yeah. So I studied MBBS, that's medicine. In China.
I'm trying to measure it, you know. Okay.
Yeah. So
Continue.
MBBS, of course, which is bachelor in medicine and bachelor in surgery. So I'm a certified doctor.
Yeah. All right. So my first question to you is, what's your definition of skincare as a doctor?
So when we talk about skincare, skincare is the method of treating or taking care of the skin. So when we say treating or taking care of the skin, it is the usage of cosmetics and also your lifestyle, maybe probably avoiding direct sun, avoiding excessive alcohol, and then quit smoking. Smoking affects the skin because at a point, as our body, right? How the body works is, I'm going medical.
It's okay. You're a doctor. We are here to learn, guys. We are here to learn.
Okay, so we have a heart, and the heart pumps blood. So the blood from the body is deoxygenated. Okay, so then the blood from the body goes to the lungs, and when it goes to the lungs, oxygen is outside. The plants produce oxygen, and we inhale that oxygen. But when cigarette comes into place, instead of inhaling the oxygen and then fixing it into the blood, and then the heart pumps the oxygenated blood to the body, which of course the body needs oxygen. Then this is where your cigarette comes in place and then replaces the oxygen with nicotine. So then that's why it hits faster, because when you smoke the cigarette, it goes and then attaches to the alveoli and then goes into the blood, and then now it disperses a nicotinous blood, not oxygenated blood. Whilst now the body needs oxygen to now facilitate the body functions. Okay, so with the use of this nicotine, you now get dehydrated, and it will show on your skin. So with the skin is a diagnostic tool whereby a doctor would now, when you go to the hospital, the doctor will now check your eye, will check your skin, your nails. It is one tool to check what sickness that you are facing. So dehydration shows on your skin.
This is new. This one shocked me. Anyways, I'm sure that a lot of people would understand why their skin is dehydrated, like you explained now. But it's funny. There are some people that don't actually smoke, and their skin is still dehydrated. What could happen?
Maybe they are taking drugs that leads to their dehydration. Probably they are not taking much water.
They are not taking much water.
They are not drinking much water. And now people are so concerned about making money that they neglect their own self.
Money be the main thing.
Yeah, but like when you forget your own health, I don't think you can make wealth. Health is wealth.
But without money, you'll not even be able to fix your health.
Even some people even do have the money, but they don't even take care of themselves.
Well, I blame those people.
So you should just take care of yourself. Drink more water.
A lot of water.
Yeah, a lot of water. If you are tired of the water, just substitute water with
For
tea.
your skin's sake, how many bottles of water do you recommend? Like for your skin's sake, how many bottles of water do you recommend drinking per day?
Okay.
Because you have limitations.
I wouldn't act like the regular doctors where I'll now come and tell you that drink 8 bottles of water, like all those cliche, I recommend this for you.
Okay.
All what I'll say is get yourself a cute, nice bottle, fill it with water. Whenever you feel like it, you
warm
drink.
water or cold water or any
So
type of water.
depending on the weather and how you feel within, don't like punish yourself and say, oh, that will even cause more stress. You get it that, Dr. Fortune says drink like 8 bottles of water.
So you're removing yourself. You're removing yourself immediately.
that Dr. Fortune said drink like 8 bottles of water. So like if I don't, you're just coding yourself. So just get a cute bottle. You know, when you go outside, there are water like dispensers. You just fill it up and then like keep on drinking it.
Okay.
So just have a habit of drinking more water, and practice makes perfect. So like
so at the end of the day you get used to it.
Yeah, you get used to it.
So you know, in some situations, let's say I want to start skincare journey now.
Yeah.
You know, what are the first things I need to do? Like my skin type, how do I identify the kind of skin? I know that I'm black. There are a lot of black people, right?
Yeah.
But there are still people who say, there are shades of blacks or whatever. So how do I identify my own skin type?
So skin type is different from skin color. We have a type of skin and we have the color. When it comes to the color, that's where we now discuss about the tone. You know, it's tone. You guys are into photography, so you know, like there are lighter tone and darker tones. That is aside, it's a color thing. But when we talk about the type of skin, that is when we talk about the dry skin, we talk about the oily skin, we talk about the combination skin. And some people also say they have a sensitive skin, okay? But sensitivity, your skin being sensitive could be dependent on some things that you do. Probably you could have an allergy, maybe you could also be using some products that are harsh to your skin naturally. And so as at that point you are sensitive to something. You get it? So when we come to the types of skin, how to identify your skin type, first of all, you wash your face. You know, the face is the most seen skin, so you wash
the most what
seen, like that's what people see.
Okay, the most seen.
That's what people see. So when you wash your face, wait for 30 minutes. After 30 minutes, when your skin is dry, that means you have a dry skin. When your skin is oily, you have an oily skin. But then when your T-zone, like this side, is oily or dry, and your cheek is oily or dry, that is like a combination skin.
Of dry and
so like of dry and then oily. Some people have oily cheeks and then dry T-zones. Some people have oily T-zones and then dry cheeks. So
so
that's
saying,
combination.
So if you want to find out what type of skin you have, you should just like
wash your face, and don't use any product.
No, like after washing, you don't clean it up at all.
You clean it up, but then don't use any products.
Okay, just leave it there.
Just leave it
and
there.
wait for it. Maybe it's gonna dry or it's gonna be oily. So what happens if it is oily? That means you have a oily skin. So now let's say I have an oily skin. Where do I start from? Like, what do I do from there?
So when you have an oily skin, you may be prone to acne because you know. Let's switch from medical to normal lifestyle.
Okay, I'm liking this.
When I smear oil on something, it can attract dirt easily, and the dirt.
You mean groundnut oil, or which of the oil?
Like let's say vegetable oil, vegetable oil, and I smell vegetable oil on the table, and the table is exposed to a dusty area. It's easy for the table to be like with a lot of dirt because it's attached to the oil.
It's thick.
It sticks to the So that's how your skin is. When you have an oily skin and you are exposed to outside, it's easy for the dirt to be. So when the dirt is on your skin, now the body wants to like remove it. Like, let's say
it gets stuck.
By itself. It gets and unfortunately for you, when it gets stuck into the pores, your body immune system just wants to eradicate it. So during that process, that's where you get the reaction that leads to acne. Because like dirt is in your skin and the body wants to remove it.
I want you to tell us about acne.
Yeah.
Like, tell us more about it, because there are a lot of people battling with it. So tell us about acne, please.
So even one country, which is Singapore, once stated that acne is a pandemic, because like everyone has acne. Yeah. So
I'm not saying it on your face now. Or because you're a doctor, you've dealt with it.
Maybe because I take care of my skin.
Okay.
So with acne is an inflammation that is, let's say, a reaction of removing some dirt. So when your skin pores get clogged, like it get blocked with dirt, maybe bacteria, then you are prone to you'll be easily prone to acne because your body wants to remove it, and that immune reaction causes acne. Okay, so aside the bacterial side, also your hormones can also cause
hormones.
Yeah, your hormonal imbalances can cause acne. So in some females, okay, you can see that some females have beard.
True.
Yeah, those females most of the times are diagnosed with a condition called PCOS, that's polycystic ovarian syndrome. So this condition, okay, it makes the ladies, like, their testosterone levels are high, and this testosterone level that is high makes them produce more oil, just
on
like
the face.
Yes. No, on the body
generally.
Okay, yeah, generally. So as I said, the process of like attracting dirt and then it reacting and everything, it's easy that these people can be prone to this acne.
Yeah, acne.
They have worse acne. You can see ladies with very, very worse acne. Most of the times they have this condition, and such people must go and visit the gynecologist, because it's a hormonal stuff where they will be recommended with, I don't want to say it so that then people will now abuse it. So you just go.
You're a doctor now.
Yeah, I'm a doctor, but I wouldn't like to now. Of late, social media has made people like do self-recommendations. So okay, Dr. Fortune said, okay, if you have this worst acne and you have a, let's say, beard, then that means I am this, and then let me go and get this, instead of going to see the doctor, where the doctor will run tests on you and verify that you have this, and then I just don't want to mention.
Give us expo. Give us only be for us in this studio. Give us expo.
So yeah, and then hygiene. Your bed, and you always sleep on your bed. So it's advisable to like wash your beddings,
everything,
because you would be sleeping on it. And if
I understand. So for instance, now in China we have multiple weather conditions, right?
Yeah.
So now, how do you, when it's winter, it's all a different thing. When it's summer, it's different. So how do you handle it? Let's say, for instance, I have an oily skin. In winter, we all know that having oily skin, even though it's going to be much, it will not really, because it's not, there's no heat, you understand. But in summer, if you get oily skin inside summer, you self go hear them. Like, you understand what I'm saying?
Yeah.
So how do you actually handle that? How do we, let me just say we generally, because you have figured it out, yeah? So how do we as a normal people handle such thing based on the weather condition?
Okay. So with the weather condition,
Yes.
comparing to Africa, it's very different. Here we have like 4 seasons.
Yes,
That is
exactly.
winter,
Exactly.
spring, autumn,
Yeah.
and in summer. So during these times, see the weather. What's the weather telling you? Is it dry? Is it humid? When it's dry, you should now consider water.
When it's dry.
When
You
it's
mean
dry,
drinking it?
drinking water.
Okay.
Drinking lots of water than the regular. Of course, on the normal, you should have to drink water, but this time you have to drink more water
More
because
water.
it's easy that you become dehydrated, and dehydration will lead to dry skin. It's not because Africa during December, it's like even in Africa during December is Harmattan.
Yes, ma'am.
And it's advisable to drink water. So you shouldn't now say that, oh, my mommy didn't teach me like that this way.
Just
So
kidding.
like your mommy is not in China. You have to now reparent yourself and
Yes.
tell yourself that, oh, during winter, this is my ritual that I'll be doing. I'll be drinking more water. And you know, some people feel bored about the water because water is tasteless. Okay, so if you feel bored drinking more water, just try to substitute and just get tea. But
what
don't
kind of
add
tea?
sugar to your teas.
Why? What does sugar do?
Why should you be adding sugar to tea?
Well, you know
Like,
those sweets now.
if you work with Chinese don't add.
That's Chinese. I'm not even Chinese. Am I Chinese? I'm
Why
not.
should you be adding? Like, this is something very serious. Why would you add sugar to tea?
Wait, maybe the definition of tea that you're talking about is
Not
different from
Milo tea. I'm talking about
which tea? You mean the Chinese
stuff.
version
Yeah.
of tea? No, that one I understand, because when you say tea, I'm going African now. You understand?
See.
If they talk tea
Even
for Africa, we know what
I'll
tea
say
means.
the Milo tea is a chocolate tea. It's like a nightcha.
Okay, na tea. Oh.
So yeah, like there's hua cha for those who don't understand Chinese.
Okay, she's actually talking
flower
about
tea.
Chinese tea.
Yeah, the
Let's just say
Chinese tea, oolong
yes.
tea. You should just take the oolong tea because let's say
But that one doesn't have taste too now.
yeah. So like maybe it's the color. Maybe the color.
Color.
Yeah. Because like you are drinking water, you feel bored, like, oh, I'm just drinking this water. Let me change.
I
something.
swear. Guys, I swear there's no difference between in fact water is better. But elsewise probably the Chinese one is
sometimes
okay.
the Chinese one is bitter.
It's not sweet. So why would I
sweet.
leave water and drink that one? Unless I want to like drink
But
it.
people drink alcohol.
People drink.
Is it
at least
tasty?
alcohol is they are getting something almost immediately. If they are drinking Chinese tea, nobody knows what is actually happening.
But
in the
something
body.
is happening.
I'm not feeling it.
You won't feel it.
And that's the point. But if I'm drinking alcohol now, though I don't drink alcohol,
you see,
please.
I would associate this to normal human beings. Like,
Okay.
like if someone do good to you, you will not appreciate it. But when they do bad, immediately. So the
It depends
negative,
on the good, and it depends on the person.
Okay, so the good, when you drink tea when you are like having flu, you feel it now.
Oh, hot tea. Hot tea.
Yes, hot tea.
So if it is hot, anyways, continue.
So yeah.
Anyway, this is important.
Okay.
Very important to me. For us now that we are struggling with, one or two things, on our skin. How do we maintain? Let's say we've done all these things and now we've gotten the good skin, the perfect one. Now, how do we maintain it? Do you understand?
Okay.
How do we maintain it?
So this question, a lot of people do ask it.
Because they don't know. They don't know. And we want to know.
Someone will now go and buy organic products. Organic. And the organic product will now bleach the skin fine. And the person will now come, how do I maintain this bleached skin? You understand?
Okay.
So you maintaining a bleach skin, you have to continue using that bleaching product.
Yeah, true.
But now you want to switch to the healthier side. You become darker. You understand me? So when I think your question is like how do
I
maintain
maintain it?
a
Yes.
natural skin.
I did not have natural. No. Natural
What
skin,
about the bleached
natural
one?
skin is different. The bleached skin too
It's
is
different.
So now let's talk about me. Let's say, for instance, now I want a kind of skin, and I know that it's bleaching, and I want to bleach. So now, after bleaching, now in my own definition, I've gotten a perfect skin because it is matching with what I want, right?
Okay, your
So now,
desirable
how do I maintain whatever skin I manage or struggle
to get.
regardless of if it's bleaching or not bleaching, blah blah blah, all those things. Yeah.
It depends on the product that you use. Some products, when you stop using it, you now get side effects. Yeah.
Okay.
And some, while you are using it, you now have dark knuckles, stretch marks, and stuff like that. So my advice is that when you want to have a certain kind of skin, you should go the natural way. The natural way. Let's say using products that contains, let's say, hyaluronic acid to make your skin like
Hydraulic acid.
hyaluronic acid.
Oh, sorry. I thought I heard hydraulic. I was
It's
like,
not hyaluronic
that's what I thought I
hyaluronic
heard.
acid.
Okay. Good.
That will make your skin moist.
Okay.
So most of the times I used to relate medicine to normal lifestyle. Okay. So when you have a garden, okay, you have to water the garden.
Sure.
Before the garden will become green. Because everyone likes a green garden, right? So watering your skin or making it moist will make you have that glowing effect that you want.
Okay. Now, from the beginning, you said if you have oily skin, you attract that.
Yeah.
Right. Yeah. So that's being moist. Is it not oily?
No.
It is not oily.
It's not oily.
Different kind of moist.
Moist is fixing like water in your skin. Moist, like to make something moist, like water.
Okay, let me give an example now.
Yeah.
If my skin it's dry right now, right? It's not moist.
Okay.
So if I have a oily skin, it won't be like this.
It won't be
dry like this.
It will be oily.
Will be oily.
Yeah.
So now, how do I differentiate between that oily part and the moist part?
So
what's the difference?
With the oily part, it's so clear. You can see that your skin is oily. Yeah. Okay. So with oily skin, you now have to reduce the oil with a product with niacinamide. So niacinamide is a vitamin B3. You get it? That will reduce that oil. Then now show off the moist that I'm talking about.
They taught you this, nitro, that in school?
Yeah.
Oh, it's a doctor thing, Sha. Anyways, let's go natural a bit.
Okay.
Because I'm kind of tired of all this iodine. You said something the other time. Yeah,
hyaluronic acid.
Yeah, what she said. All right, so let's go natural a bit.
Okay.
To our own level.
Okay.
What kind of food can we eat that would help the skin? Is it banku? You know, in China, it's all about rice, banku. What other food? There's no other food, actually. Rice, banku. Maybe you are cooking your Ghanaian food.
I cook a lot of stuff.
Like what?
Fufu, banku, kinki, jollof, Ghana jollof.
Don't add Ghana.
Ghana jollof.
don't add Ghana. We're not bringing that here. Please.
So,
don't add Ghana. Just say jollof. Don't worry.
Jollof. Okay, basmati jollof rice.
Okay, good.
That one we are going India.
It's good.
So, I eat a lot of stuff, especially fruits. Anytime I eat, I end it up with fruits. So I think if you don't have that in your routine, you should fix it. Because fruits, they are so good.
Any kind of fruit? Or there's a particular kind of fruit that you would recommend your patients?
I wouldn't put my patient on certain kind of strict diet, but then randomly taking fruits, and then the one that is best for you. We all have different body types. Okay, what I may be allergic to, you may not be allergic to that.
Yeah, true.
So you should know your body. That is the first step.
You see, that's the problem. It is not everybody that know their skin. So I should eat fruit according to my body. So unless if I eat a fruit today and it affected my tummy, then I know thou shalt not eat this.
Yes.
But so what if
you don't try? If you don't try, how would you know that this is bad for you?
I don't know.
So you, at a point in life, you should experiment things to know that this is good for you or not. Because the first try wouldn't kill you.
Okay, but it will waste my money.
A little, and then it will save the future wastage of money. Yeah.
Anyways, moving forward, okay, you've actually answered most of the questions I have here because this question says that how do our lifestyle affect our skin? But if from the beginning you already mentioned the fact that smoking affects your skin, it does this. So apart from that, what other area would you say that our lifestyle, what we do on a daily basis, can affect our skin?
So what we do on our daily basis, let's start from morning to evening, right?
I'm sure now, what thing you want to start from before?
So in the mornings, when you wake up, you should have a very simple but effective morning routine, whereby you go to the bathhouse, you wash your face, and after bathing, of course, you take in your breakfast. Your breakfast.
Not everybody eat breakfast in China, you know, right?
Yeah.
Do you eat breakfast?
Why don't they eat breakfast?
Do you eat breakfast?
Sometimes. I can't say I'm perfect.
I can say that 60% of foreigners don't
like
eat
100.
breakfast. Even 60%
but when I'm going
is
to
small,
school,
right?
no, like
even going to school, you don't get time. You have class at 8 o'clock. You know that your eating is till break after. We're kind of used to that
China
lifestyle.
can be crazy.
Yeah, we're kind of used to that lifestyle. So if you are having eating breakfast
from home,
back home,
no, like
from your house,
when you
wake up
to the class.
Okay, continue. Let me let you land.
So yeah, you should try to have your breakfast. That will kickstart your day at least. Yeah, and then so like your routine for the day should be like you should eat, okay, drink water, and then when it comes to alcohol, our lifestyle, alcohol dehydrates your skin also,
and smoke.
That's why it's hard. Yeah,
two things.
Alcohol.
Do not drink. Do not smoke. If you want a
it's
good
not like
skin,
do not to. See, it's not like do not.
Okay.
Every doctor's advice on alcohol and smoking is avoid excessive drinking. Do you guys get that? Like,
so we
excessive.
can drink.
You can drink. There's a reason why alcohol is expensive. There's a reason why alcohol, they have the whack one, they have the good one. There's a reason why alcohol is there at the first place. If it wasn't good and it's bad to the body, they wouldn't have sold it.
But they will write on the body of a cigarette.
Drink responsibly. That's
Apart
what they write.
From the cigarette version, they will write that smokers are liable to die young. Are you saying that? As for alcohol now, you can drink, it's okay, but not too much. Can you smoke and not too much?
The smoking is addictive. It's easy to be addicted to smoking. But I believe that I don't smoke myself. I don't like it.
You don't like it?
I don't like it.
You don't smoke because you don't like it, or you don't smoke because of your health, or because of your skin? Which one?
I don't like it because it would be detrimental to my health. Like, I love myself that much that I wouldn't like. Yeah,
we love ourselves too. No, are you saying people that are smoking don't love themselves?
I don't know about them. Like, unless I have an interaction with them, why they do smoke. But
they say they're relieving stress.
Well, I can't relate to that because I've never smoked because after knowing the mechanism of the smoking thing, I can't go back. I say back, I can't go to it to like now smoke. No.
Okay.
Yeah, I don't like smoking. So I can't relate to it. But then I believe that when you know what smoking does to you, it will motivate you to stop. I feel like there are a lot of things that news that go around that quit smoking, and I wouldn't join the voice like because everyone knows that smoking is bad, but people do it regardless. Yeah.
So, would you recommend that people, before anybody starts any skincare, whatever, buy any skincare product, they should visit a doctor first, like a skincare doctor first?
I don't think it's needed until it's a health concern
It's a
because
skin thing.
it's a skin thing. But when you have a dermatologist, it's good. It's to your advantage, and I believe that social media, no, not social media. Social media is another thing, but there are resources out there, especially on the product. They have ingredients. Okay, ingredients are written there. Take a minute or two to research about what you are using on your
Some people
skin.
don't get time, sha. That's another thing.
Yeah, so then that's where you now have to invest in having a dermatologist. Okay, so
okay.
so that
Now
like
it makes sense.
yeah, so that you can like be advised on the right thing because that would be easier. That like you come to, let's say, someone like me, and then you be like, I've been
Because you don't
experiencing
know
this.
this, you
Yeah,
don't know
you
that.
don't know this. So it's easier for me just like, I'll just tell you that, okay, because of this, you just get this, use it for a while,
Yeah,
don't use this.
that's true.
Yeah.
Anyway, guys, we'll go for a break. We'll be back shortly. Welcome back, guys. Welcome back. I still have a few more questions to ask you. Are you ready for us?
Yeah.
Okay. But before we go into those questions, I see that you brought some product today.
Yeah.
To the studio today. I'm wondering. I've been saying this name. I don't understand them. So can you please feel free to explain? So now this is how we're going to do it. Now I'm seeing moisturizing lotion.
Yeah.
What does this do?
So with this moisturizing lotion, it seals the moisture in your skin. So it's just like lotion that you use.
A normal lotion, right?
Lotion, yeah.
Okay. I'm kind of surprised about this brand.
Yeah.
What's your connection with them?
It's a trusted brand, so that's what I recommend for my clients. Because what I do is that like I consult my clients before I recommend a product for them.
Okay.
So I have sourced and I know for sure that Cerave is good. Yeah, it's not like I'm advertising for them, but yeah,
Okay.
good is good. Good sells itself.
All right. So before we go back to that, let's just hold on. I have a question here that I omitted before, which is very important. So now, what are the most things to consider when it comes to skincare to both men and women?
So with the skincare, as I already said, everyone has his or her own conditions. Okay, so knowing yourself first is the most important thing. Yeah, because some men may have different skin types, different skin reactions, and stuff like that. So if you have that, you should take care of it.
Okay, I've seen. Okay, let's say for instance, shaving stick.
Yeah.
You're using a shaving stick and a clipper. So let's say some people, when you use shaving stick, they get those things,
Those stuff.
but when they use a clipper, they don't. What happened? Is it a medical thing, or is the shaving opposite side thing that caused it?
It's a skill, right? Yeah, you
People from experience.
practice make
Me,
perfect.
I don't have, so I don't know.
You have a little. Right, where you growing?
This one pain me. See the way you mentioned a little. Jesus. No worry, God will remember me.
Is it because of how I did my hair? Like
A little.
Like actually,
I have the
compared
lot.
with like I'll be like you have a lot.
So no, wait. Let me say it. I had a lot, but based on the fact that I don't like it. But anyways,
so
I get what you're saying, Cha. So the main thing is actually knowing the direction in which your hair is growing, so it doesn't affect. So now, what about for ladies, like you mentioned, the ones that grow beards?
Yeah.
Those things, is it possible for them to have those kind of things?
Yeah, it's possible because they have beard. It's possible. So I would just advise that when you are doing, there are other options to shave. You can do waxing.
Who they envy people when they do that one? No. You do Jesus.
You can
if you can do that
yourself.
thing, you are a wicked person.
People do it to themselves.
I can't even peel my own hair, like do this, not to talk of.
I feel like they see.
Is it not painful?
Yeah, it's an option. So it uproots the hair follicles.
And there's no effect. That's why it's painful. And there's no effect on that one.
The effect is the pain now.
So there's no effect, like an after effect when you're shaving.
But when you are shaving, you leave your hair root there. But when you
so this one is removing it from the root.
So now it will now have to grow. With social media, because of the nowadays a lot of influencers out there influencing for brands and also businesses that are now on the social media. People just come out to say anything. So far as you have a convincing voice, good influencers behind your brand, it's easy to influence other people. If you don't have self-love, you've not accepted yourself. I may have a lot of acne right now due to maybe something I have done. You get it? Of course, some people also neglect what they do. Yes. Like, they'll now come with dark knuckles. I don't understand the reason why I had this dark knuckles. But then for sure, like before God and man, in your room, you have a lightening cream sitting comfortably on the chair.
Some people don't know that, okay, for instance now, you're battling with a particular kind of thing on your skin. Now the only thing you have with that thing, but in the process of you dealing with that thing, you bleached yourself.
Okay, that's a different case.
If I was dark and in the process of looking for a way to clear my skin, then I get brighten up, it is going to be difficult psychologically to actually go back to being dark, based on the
because
society
of the praises.
factor. Not even the praises alone, based on the
standard of beauty.
Yeah, and also the validation outside. Oh, you're getting dark. Are you okay? That kind of thing is a lot.
So then that's the effect of social media, and then a whole lot.
So if you want to have a very clean screen, just get off social media.
Yeah. Even if you want to have a better life, okay, don't take rules and regulations from the social media, because I realize that even nowadays there are people who have mental issues, like serious ones, that they have phones, very good phones, and you are not restricted. So far as I have my phone, I can do anything. I can create any content.
Yeah, sure.
Mad person, they create content past normal persons.
All right, so my last question right now is not even a question, it's a request. Let me drop my tab. That what advice would you give anybody that is struggling with skin? I don't want to say skin disease, but you understand, you're a doctor, so you use the right word. Skin problems. Okay. Yes. So what advice would you give them?
The advice I would give to anyone who is having a skin issue is just calm down. First of all, that's the first thing to do. Calm down. Seek for expert advice, just not a random advice from maybe one auntie or one uncle somewhere. Spend some time and some money, go see your doctor. He or she consults you and give you the right product to use, and then you're good to go.
Thank you very much for coming. But before you go, there's just one last thing you would do. Okay. Somebody sent in a question.
Okay.
Yeah. This product.
Yeah.
He said that when there's a particular product that is itchy.
Okay.
You understand?
It's itchy.
Yeah. I don't. That's how he said it. It's itchy, and I think it's. I don't want to like pick it. It's one of them. After using one, blah blah blah. Now, before you answer, in your answer, I'll give you the room now to actually explain what we have on the table and how to use them. You understand, and stuff like that. So you should also add the answer to it.
Okay.
You understand? So how best can we use all these things to actually get a very nice skin? Yeah.
So basically, with the skin routine, talking about skincare routine, you first of all cleanse. That is to wash your face of any dirt or anything. Yeah.
Yes.
Then secondly, if you have any kind of persistent condition or skincare condition, then you now treat it with serums. We have serums like the niacinamide oil production. We have some called the alpha butene, which will reduce your dark spots. We have retinol that will now repair your skin. We have toners, that is a glycolic acid, and then others. Okay, so that is the treatment.
All these things you mentioned, are they?
Yeah.
Or can you just point them, because I'm just hearing tetraoxocarbonate, acid. I don't know.
So like this is a cleanser. This is a foaming cleanser.
Okay.
But this cleanser has niacinamide in it. You could realize that they've written normal to oily. Okay. So a normal skin can use it, and then an oily skin can use it. Okay. So it has niacinamide in it. So with the normal skin also has oil. So it's okay to use this, it to cleanse first, right? So if you have an oily skin and you're using this and you're experiencing being itchy, then you have to stop using this, because the niacinamide, your skin must have oil, okay, but not like too much. So if it has too much oil, then use this.
So when you stop using this because of the itchiness, right?
Yeah.
So what other one would you use?
They have ranges, okay, and then they fix some particular ingredients in it that makes the colors different. I just want you to identify it. But this foams.
This foams.
Yes. So when it foams, it breaks the oil.
They do the same thing, the same work, right?
It just cleans your face.
So if this make my skin itchy, I should stop it and use this. Let me see this one too.
So this has hyaluronic acid in it to make your skin.
But now here I'm saying for normal to oily skin, for normal to dry skin.
Yeah.
So now what does this?
So you see, dry skin doesn't have moisture in it. So this will fix moisture in your skin.
Okay, so the reason why the itchiness comes is because of the fact that my skin is dry. The oil is gone.
Yeah.
So now this one puts the oil.
No, this one puts water in your skin.
Okay, when I say oil, I actually mean water, though. In our own language, you understand what I'm saying?
Like it will make your skin moist and soft. Regularly, you will bath with your shower gel.
Okay.
Yeah. So after
using this, so now for you to, if you're feeling itchiness, use this. No. If you're feeling itchy after using this, you should switch to this. Yeah.
So as I said, the process after cleansing, you treat. After treating, then you use this.
Okay, so this is actually the last. Let's go to this.
So this is a toner.
Okay.
This toner is a glycolic acid toner, where it will now clear your dark spots. What it does is that it would remove the dead skin cells, and it's not like it will peel it. It will now dissolve it a little.
So after washing, then you knock this one. This one has serums or what?
Yes, serums. Peeling solution. This peeling solution's job is just like this. It's very strong. Yeah, you have to use it like 5 minutes.
It has to be on your face.
For 5 minutes.
You wash it off.
And you wash it off.
What about this?
And this is niacinamide. So you see what I said about the green product? It's reducing your oil production.
Yes.
That is what this also does. It reduces the oil production.
I've actually learned something today that the drier your skin is, then the more itchiness it will be. So the rest, what are they?
So with the red one, this is faded from topicals. So it's clears dark spots.
Tell me this one again.
This is it's a cream.
No, but this one is thick.
Yeah, this is thick. So if you when it's sealed, so
it's sealed.
Okay. Yeah, you can open it. Yeah,
Okay,
so this is how it is. It's thicker, so it would just seal the moisture. Yeah.
Anyways, okay, which one is this one? Pure vitamin C10.
Yeah. So this is from La Roche-Posay. It's a vitamin C, and what it does is that it just boosts your skin immune system.
Oh, so the skin has immune system too.
Yeah.
Like the body has.
Yeah. You know, the skin
you
is
really
an
need
organ.
a doctor, guys. Anyway, guys, thank you very much for watching this episode. Don't forget to like, share, and subscribe, and comment as well. Let us know what your problem is, and if you want to get in touch with Dr. Fortune, we'll be dropping our contact details on the screen. Thank you very much. This is HafrikTV signing out now. Bam, clap now, guys.